People say there's not a lot that's fair about life and death. Well, imagine that you're being told by your doctors that you only have weeks to live. There is a cancer medicine on the market that could prolong your life, but that it's too expensive. Well, this sort of health rationing goes on all over the world. But in Britain, where the National Health Service is particularly overstretched, there are sometimes some pretty tough decisions being made.
David Freeman cycles to keep fit, even though his doctors have told him he has just a few weeks to live. David isn't prepared to accept this, but he's been denied treatment that might prolong his life, even if it can't cure him.
I think I'm fighting cancer on my own. Now I'm fighting the NHS to get the treatment which surely I deserve, you know. I've worked most of my life, retired about 2 years ago. So you think, well, if you've paid in, surely you get some sort of treatment, but no.
Every day, David phones the local hospital, hoping to fill a prescription for life-prolonging medication. But so far, the National Health Service and the clinic have denied his request. It would cost €33,000, and apparently that's too much to spend on another few months for David.
Right.
And he knows that you're...
I know they're expensive, but as far as I'm concerned, expense doesn't come into it in my particular case. I know you might say, well, how does that come about? Well, I don't think the money, even though the government keeps saying they're going to fund it this month, right?
By the government, he means the National Institute for Health and Clinical Excellence, or NICE. In fact, it's an independent organization that provides national guidelines on preventing and treating illness. It also works out whether a drug is worth paying for, weighing up the costs against benefits.
It's a balancing act, and it's the aspect of philosophy that's known as distributive justice. How should we most fairly share out our finite resources between us? It's a tension that's been debated since the time of Plato, and nobody has come up with an overarching solution.
Kate Spall lost her mother to kidney cancer. She doesn't agree with the NICE recommendations. For example, when it says that a drug should not be prescribed when it can only prolong life by a few months.
The drugs were licensed, which means it's legal to prescribe them. However, we have these different layers of bureaucracy that act as blocking mechanisms, really, for access to those treatments. In other parts of Europe, that authorization, the marketing authorization that they receive, the licensing, is enough for them to actually use it.
After a series of public complaints, NICE changed some of its rules. Now, certain drugs can be prescribed by doctors even when they can't deliver a cure, but can prolong life by a few months. But not in every case.
It can't be an open check, a blank check. We have finite resources for money, and if we spend a lot on us one group, it means we will deprive other people of cost-effective care.
NICE insists it knows what it's doing and points out that 15 other countries have followed the British example. Even critics acknowledge that its task is an enormously tricky one, but they maintain that only doctors should be deciding which drugs patients need, and not bureaucrats in some office.
You think, surely I'm the doctor. If I think this patient should have this drug, I'm not going to make silly decisions. I'm not going to give 95-year-old people with dementia £20,000 worth of a drug over a year. You just wouldn't do it. And yet, now we're completely in the hands of a bureaucracy. There's NICE, and then there's those that pay for care that create this bureaucracy. And that's what I think many of us in Britain are frightened of.
Another problem David has to deal with has to do with where he lives. In some cases, local health authorities can overrule NICE recommendations. That means doctors can apply on behalf of individual patients for exceptional funding from local health boards. David's didn't. Had he lived somewhere else, he might have been luckier.
What they did years ago, they stalled around, give you CT scans, get you comfortable and say, you're just going to die, Mr. Freeman. There is no hope at all, but I know there is hope, and that is why I'm determined to seek it out. I think the success of beating kidney cancer is not very far away, maybe a year or two, maybe less.
David Freeman's options are running out, but he won't give up. For him, this is literally a matter of life and death.